My name is Manish,
And I'm Stephen Choy.
and today we are presenting on the global drug epidemic and how it is currently debilitating communities and global health systems, while also highlighting our project addressing the issue. To quickly introduce ourselves, my name is Manish, and I'm a rising senior from Independence High School in Frisco. I'm very passionate about neuroscience, and I'm an aspiring psychiatrist. I'm a member of HOSA, a member of the Stanford Neuroscience J Club, and currently a STARS SRP intern at UT Southwestern, conducting research on the FOXP1 gene. Outside of medicine, I hold leadership roles in our community's Key Club and Model UN, among others.
Hello, everyone. My name is Stephen Choy, and I'm also a rising senior from Independence High School. I'm currently CNA and CCNA certified, and I'm passionate about music and volunteering. It is my passion for service that I founded my own nonprofit, Blankets for Patients, which works to create and deliver handmade blankets to hospitals. Other organizations I'm a part of are Colors for Hope, which makes and delivers artwork to patients, HOSA, and Key Club.
To begin, the global drug epidemic is the combination of substance use, addiction, and the industry of drug production that causes harm across the globe. It includes a variety of drugs, notably opioids, powerful stimulants, and psychoactives, and its effects range from the individual scale, including addiction, to a regional scale, including the harmful production of drugs and the contamination caused by this production, to an international scale, including human rights abuses.
So, how do drugs such as opioids work? Normally, receptors catch neurotransmitters to activate your nerve cells. However, opioid receptors do the opposite by stopping electrical pulses. This can result in the euphoria that people seek, as well as negative effects such as drowsiness, nausea, and vomiting. However, a major issue with drugs and opioids is addiction. Opioid addiction starts in the midbrain, where mu opioid receptors turn off GABAergic neurons, leading to the pleasure circuits to be filled with dopamine. As dopamine flows into the amygdala, it begins to relieve anxiety and stress, reinforcing the idea that opioids are rewarding. However, the repeated use of opioids and other drugs leads to neuroadaptation, where the brain's neurons adapt to the presence of the substance. This ultimately results in tolerance, dependence, and withdrawal symptoms such as anxiety, irritability, and cravings. Though they use different pathways, other classes of drugs have similar effects.
Looking at a global view, the most prevalent and potent narcotics around the world vary by region, but still cause the same significant levels of addiction and overdose. These include fentanyl in America, ketamine in Southeast Asia, tramadol in Africa, etc. On a regional scale, the drug epidemic negatively affects the health of workers in various steps of drug production, exposing them to unsafe environments and extorting regional businesses, disrupting economic access to healthcare. The production also harms nearby environments, creating toxic waste in waterways and soil that humans eventually consume, causing long-term health detriments. Internationally, drug production and smuggling to fuel addiction demand results in massive trafficking of women and children, who are often forced to swallow drugs to bring them across international borders. Drug production also correlates with massive amounts of labor violations, reduced access to health, specifically through expanding addiction and causing governments to criminalize addiction rather than treating it, and preventing justice systems from combating drug enterprises, all of which violate internationally recognized human rights law. In these ways, the drug crisis is not an event occurring in a vacuum, but rather a large-scale epidemic destabilizing the health of billions while debilitating the political and economic systems that are meant to provide care that combats this. In order to address the effects of the drug epidemic in our community, we created a campaign called Break the Stigma, with which we hope to increase consciousness of drug use and stigma while improving access to addiction resources. We began with a pre-survey to gauge the specific issues in our community relating to substance abuse. We found that while the majority of respondents said that drug abuse was an issue, only a quarter of respondents believed it was an issue in our community. Only 19% of people knew someone struggling with addiction, and the majority of respondents, when asked to name drugs they believed to be an issue, named nicotine and alcohol, two low-risk drugs. However, around 44% of people said that community understanding of these issues was scarce, and the majority of respondents showed agreement with statements reflecting stigma against addiction, which has been shown to reduce the help sought by those struggling with addiction. We concluded that while drug use is still an issue in our community, ignorance about substance abuse and the stigma community members had towards addiction was more prevalent, which resulted in our campaign goals to focus on these issues. To increase our community's understanding of these topics, we created posters hung at various community epicenters and schools, each of which highlighted the effects of drug use on personal health. They also highlighted the impact of stigma against addiction on addiction patients and advertised various resources for addiction care, including helplines and charities that increase access to naloxone for fentanyl overdose. We also raised $3,000 for charities combating drug use, ran a successful social media campaign highlighting these topics, and presented to multiple audiences.
Along with this, we attended an anti-fentanyl presentation by the attorney for Eastern District of Texas office, Damian Diggs. It was this opportunity that we saw the effects of local government involvement in drug prevention firsthand. Through this experience, we were able to collaborate with student ambassadors and the FISD administration boardroom to discuss the dangers of fentanyl, strategies to address the global opioid crisis, and the importance of reducing the stigma around drugs. After our campaign, we ran a survey to see the effects of our efforts, and we found that respondents showed less agreement with statements reflecting stigma, had an accurate understanding of the effects of drug use, and displayed high confidence when it came to the respondents' knowledge of drug use and stigma. On a global scale, we can see the effectiveness to reduce drug use and fatalities through the larger scale WHO and UNODC program on drug dependence treatment and care, specifically the Stop Overdose Safely initiative. This initiative included a multi-site study on community management of opioid overdose implemented in Kazakhstan, Kyrgyzstan, Tajikistan, and Ukraine. Approximately 40,000 naloxone kits were distributed and 14,000 people were trained as part of the project. As shown in Table 3, improvements in the participant scores were observed across almost all metrics and demonstrate the program's effectiveness in increasing positive attitudes towards opioid overdose prevention. Table 4 highlights the effectiveness of drug fatality reduction programs in teaching people to use naloxone. After 6 months post-training, 34.5% of participants reported witnessing an opioid overdose, with 89.1% using naloxone in these instances, resulting in a survival rate exceeding 95%. This demonstrates the effectiveness of global drug overdose prevention initiatives.
In conclusion, the global drug epidemic affects almost every corner of the world, causing harm to individual health while simultaneously disrupting the systems meant to prevent harm to public health. Our campaign helped combat community-level issues with drug use and stigma through awareness and resources. Larger scale campaigns have shown success in combating addiction and regional harms. And movements combating the epidemic in the future can take small scope approaches targeting community-specific issues or large scope approaches addressing the cause of the epidemic.
To systematically combat this crisis, our global health system must address drug use at its source by combating addiction and overdose, raising awareness about drug use, and increasing access to resources for addiction and drug-related healthcare. By doing so, we can reduce the market for drug use and extent of the drug epidemic, thereby diminishing the political and economic power of drug enterprises and lowering exploitation related to drug production. Ultimately, these efforts will help resolve the health crises stemming from the effects of this epidemic.
As we conclude, we'd like to highlight the resources we utilized in making this campaign and presentation, and we'd like to thank these groups in our school district, as well as the Shatterproof and End Overdose charities who helped our campaign. And of course, we'd like to thank all of you for listening, and we invite you to email either of us if you have any questions about this topic. Thank you very much.